Okay, we are live now. So you can go ahead and welcome the people.
Good evening, everyone. It's another time for Ask the Pediatricians Live. Today is 30th day of August 2021. It promises to be educative and informative as usual. I will be your moderator for today. My name is Busayo Adeyemo, and I have Dr. Gbemisola Boyede with us. Good evening, ma.
Good evening, everyone. Welcome to ATP Live Monday. Please share the video, invite your friends and family. If you have any child health question, please join us now. You're welcome.
You're welcome, everyone. And don't forget to put in the vital information about your child, the birth weight, the current weight, so as to be able to supply the information that you need and to give you appropriate answer to your questions. You're welcome once again.
Okay, so please share the video. I'm trying to share to all the other ATP platform, and I hope our moderators can help me pin it so that we can go live. We are live on Facebook, YouTube, and then we'll soon go live on Instagram soon as well. Thank you,
If you're here,
everyone.
can you drop in your hello in the chat box? Hello, 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 everyone.
Just give us a few minutes. We are just making sure we've shared this video properly and everybody can see it. So, but please start dropping your questions now. And then, okay, I guess we are good. And I can go live on Instagram as well. All right, yes, we can see some people already dropping their questions. So for Instagram, hello, welcome. You will be seeing my laptop screen because so that you can see the other moderator. I guess you can hear us and you can see us. So please, if you have your questions, please drop it. You'll see me through the laptop so that you can also see the moderator as well. All right, so welcome everyone, and then we are ready for your question. Please start to drop your questions now so that we can answer them on time before 7 p.m. All right. Okay, so just all the hellos we see having. Okay. And I can see a few people joining us on Instagram. So welcome everybody. It's CTP Live. As usual, we'll be answering your questions. So I guess our questions have started coming in. We try to do everything in 60 minutes. So please drop your questions on time so that we can answer them on time and then we can finish the program. Okay, so we can go for our first question.
Facebook user is asking, 3 weeks old baby having pus in the eye, right eye, baby is on EBF, that is exclusively breastfed.
So you haven't asked us any question. So it's not enough to just give us
Lots of light.
information. So what is the question about the baby having pause? Is it what to do with it? Or so you need to be very, very specific with your question. But I'm suspecting, sometimes as pediatrician, you begin to suspect what parents want to ask. So is this baby having eye discharge? Is it what to do? So the first thing is to clean the eyes. Just use any clean cloth with clean water and clean the eyes. If you clean the eyes in the morning, like for example, when you're giving the baby a bath, and the eyes, the discharge does not persist through the day, that is okay. But if even though you've cleaned it in the morning when giving your baby a bath, the baby keep on having eye discharge throughout the day, so we recommend that you keep cleaning with that clean cloth and water and always wash your hands, and then you may need to see a doctor so that they can prescribe appropriate antibiotic eye drops for the baby. Please don't do self-medication. Don't just go to any chemist and buy any eye drop for the baby's eyes, because there are, like for example, chloromphenical eye drop, which is what most of us used to use in those days, is no longer recommended for this age group, for children below 2 years. So that's why it's important that you see a doctor. But if there's no high discharge throughout the day, just the one in the morning, which you've cleaned during the bath time, there's really no need to use anything. I hope that is what your question is. Thank you. Okay, yes, okay. I think the
Oh,
Facebook is confirming that I've
yes,
answered
I
the question
discharge.
correct. Okay, thank
So
you.
the next question from Nana. Doctors, good evening. Please, what can I do to my baby of 6 months to gain weight?
All right, thank you, Nana. That's a lovely question, but you didn't tell us the current weight of your baby, because sometimes you may think your babies need to gain weight, but your baby's weight is actually okay. So for me to be able to answer this question, I need to know what is the current weight of your baby, what is the birth weight of your baby, so that we know whether your baby's weight is even okay or whether the baby's weight is not okay. So if the baby's weight is not okay, then we can tell you. But generally speaking, for a 6-month-old, you just need to give them food. When it comes to weight, it is about food. It's not, unless baby also has medical issues. For example, some baby also have medical conditions. So if your baby has medical conditions, we need to treat that medical condition. But if your baby is otherwise healthy, well baby, I believe you should have exclusive breastfed your baby to 6 months. At 6 months, keep breastfeeding, but you should now also start giving complementary feeds. If you go to our Facebook group, Ask the Pediatricians, we have what we call guide section. If you just ask this question, our moderators will be able to direct you to the guide section. You can watch all those videos on complementary feeding, what to give, how much to give, how often to give, and you keep breastfeeding as well, your baby will gain weight. So unless there are other medical issues, so if you are giving food, baby is breastfeeding, baby is getting enough food, and baby is not gaining weight, then we have to check, are there underlying health issues that we need to address. So if we address them, then that will lead to the baby gaining weight. So it's not a matter of medication. So there's no drug to buy, and it's not multivitamin issue, because some others think maybe I should be giving this multivitamin. No, it's about making sure your baby is getting the appropriate food, and if there's any health issues, we address it as well. Okay, I hope that's fine. Thank you. Okay, Instagram, I can see you. We'll come back to you after a while. We'll switch between Instagram and Facebook. All right. Next
Okay.
one.
Susie is asking, good evening, doctors. Please, can a baby of 6 months eat adult food?
Very good question, Susie. Thank you for joining us. This question, immediately you ask that question, it shows to me that you really need to go and do that our complementary feeding course, because there's actually no adult food. There is only food. Okay, food is food. So it's just that the way we present the food to a 6-month-old is different. So a 6-month-old can eat everything you eat, but of course they cannot eat about or pounded yam like the way you will eat it, but they can still eat your yam, but you have to make it into like porridge, like semi, solid. That's what we do. So they can eat amala. It just like it has to be very soft, maybe with a weju or something like that. They can take your pap. So maybe you will want to eat your own as a core, like thick, solid. So maybe they may have to take it as more of a porridge kind of a thing. So there is no real food that there's no food label adult food. There's no food label baby food, apart from maybe what you people buy in the stores that they put age to it. But when it comes to your kitchen, there's no food your baby cannot eat. But the what we normally work on is when you are starting at 6 months, you start with soft, semi-solid porridge. Moving on to mashed food, then you move on to the solid, because of the fact that they cannot have enough teeth to chew the hard solids and all that. But the food itself, they can eat it. It's just the way you make it. So you may want to puree some solids, you may want to make it into porridge, and that's what you need to give. So for Susie, I really, really would recommend, because if we talk about complementary feeding, we can spend the whole evening talking about complementary feeding and we will not finish. And because it's a common question people ask, we have some lovely videos produced by Global Health, and they actually demonstrated how you can feed your baby using food in your kitchen, and how to mix it, the quantity to give, how to give it, and you will. So I found out that if you go through that, you will understand better how to go about complementary feeding, and there will be less frustration. You don't ever need to buy any food called baby food in the shops, or anything like that. You just need to know how to use what you have, the same food in your kitchen, how to prepare it and how to give it. And just like I said, it's just about texture. It's also about quantity. So when you are starting from 6 months to 8 months, it's porridge. Then you move on to mashed. Then you move on to real solid. And then quantity is also smaller compared to adults. So that is basically the difference. But it's still the same food we're all eating. Even the one you are buying in the shops that they are telling you is baby food. What they've just done is that they've taken it to an industrial kitchen and they've made it into a powder for you to just mix. It's still the same mix, it's still the same beans, it's still the same rice, it's still the same all those other food that you eat that you have mixed together for your baby. And of course, your baby still need to take milk. And if you are breastfeeding, you don't even need to buy any formula. But if you are not sure or you're not breastfeeding enough, of course, you may need to still give age appropriate formula to the baby. So I hope that's really answer your question. We'll take one more question, then we'll go to Instagram so the Instagram people don't start
A
getting.
Facebook user is asking, "Good day, doctors. Please, my 11 weeks old has cough and catarrh. He got that from his elder brother. Please, what do I do? I have done steaming for 4 days. He started. Is there something I can do? Really do not know, do not want to start giving her antibiotics."
Yes, you don't even need to give antibiotics. Most of catarrh in babies are viruses. They are due to viruses. They are viral infections. So, which means they don't need antibiotics. What you really need to do is to make sure that anybody who has cough and catarrh don't come close to the baby. So that's why if your other children have cough and catarrh, you keep them separate from the baby as much as possible. You make sure they wash their hands. If possible, use masks. Even if it is you, use masks. It's just so that they don't, because once they sneeze or cough or kiss the baby is exposed to the same germs. So what you need to do is make sure you keep baby warm, keep breastfeeding exclusively. I didn't see whether you are exclusive breastfeeding or not. Exclusive breastfeeding helps. It helps the baby to fight the infection by himself. If your baby is not having fever, if your baby is not breathing fast, don't worry. It's going to run its course. In other words, it's not going to go in 4 days. It's going to go after 2 weeks, because viruses tend to last for that 7 to 14 days. So it's going to run its course. As long as baby doesn't have fever, fast breathing, or difficulty with breathing, there's no need to panic. I don't recommend steaming as much as possible for babies this age, because I'm worried about burns. A lot of newborn babies, young babies suffer burns when the mom is carrying out water up and down for steaming. It's not really necessary. If you think the nose is blocked, then you can put saline drops. Saline drop is just the normal saline, like salt and water. But because they've done it in the lab, it is clean. There's no germ inside. So it just that if you just drop into the nose, you can buy it in any of the pharmacy store. You don't need a prescription for it. It will soften the mucus so that the mucus will flow out. But keep breastfeeding, keep the baby warm, wash hands, and the thing will run its course and stop. But if there's fever, there's fast breathing, there's difficulty with breathing, then you have to take the baby to the hospital, because that may be a bacterial one. The bacterial one is usually more severe and they tend to lead to what we call pneumonia. And those are the ones that will need antibiotics. But if it's just the viruses, just the cough and the catarrh, nasal discharge, but no fever, no fast breathing, no difficulty with breathing, you don't need to worry. Just wait and it will run its course. That's just all you need to do. Okay.
Thank you
All
very
right. So
much, ma'am.
let me just clear on to Instagram and answer a few questions on Instagram. Thank you, Fresh Empire. Say, Dr. Gbemi, you're doing well. Thank you. So it say Fresh Empire is also the same first person to ask the question. What can I do about my 3-month-old baby? Everyone complained the baby is too heavy. Wow. And should be lightweight. Okay. So we always have different strokes for different folks. So some baby say the baby is too light, now your baby is too heavy. The baby is your 3 months old is weighing 6.2 kg, the baby's birth weight was 3.5. Okay, for us, your baby is not too heavy. Your baby is fine. Okay, so usually I always tell people, like, all of us, just look at the eyes. All of us are tall. Some people are taller than me. Some people are shorter than me. But it doesn't mean that because somebody is a little bit shorter than you, that person is a dwarf or anything like that. It's just that we're all at different height, but we all what we call the extreme. So there's a level where somebody will now get with, okay, this person is really short, or there's a level somebody will get with, so this person is really tall. So it's a range. It's a range. So the fact that your baby is weighing 6.2, you averagely at 3 months, it's still okay. In fact, that's not even excessive weight at all. That weight is just about average for a 3 month old. So maybe most babies will be weighing that around about 5, 6 months, but your baby is weighing at 3 months. Does not matter. So just keep breastfeeding your baby exclusively. Your baby is just on what we call towards the upper side of normal. Some babies are average. Some babies are on the lower side of normal. But as long as baby is not over the average, we are not going to worry. So for me, I'm not worried about your baby. Just keep breastfeeding your baby exclusively, and that's all you need to do. So don't worry. And usually when babies begin to run, they begin to sit, they begin to crawl, some of them will share some of those baby facts as well. So I'm not even worried about a 6.2 3 month old. So there's absolutely no reason to worry, fresh. All right, thank you. And then okay, yeah, I mean, King wants to be in my video. Okay, I think that's all. Oh, that's the only question I have on Instagram for now. I hope I didn't miss any. Please drop your question. Okay, let me check in the question box. Oh no, it's not a question box. Okay, there's none there. So please drop your questions on time so that we won't have to play catch up towards the end. All right, thank you. Let's go on to Lydia's question.
Lydia is asking, good evening, doctor. My 2 months and 4 weeks baby is coughing and vomiting. Born at 35 weeks, birth weight 2.3 kg, and current weight is 5.6 kg. We are due for 10 weeks vaccine. But can I proceed with the cough and catarrh or hold on till the phase is over?
Okay, thank you. That's a very lovely question. Number one, I'm worried because you say your baby is vomiting. Because coughing, I will not even have worry, but I worry about a child who is vomiting. So, and I know sometimes mothers use that word loosely. So when they said vomiting, they actually meant maybe the baby is bringing back a little bit, like having a reflux. So I really want to know, is your baby like vomiting, like actively bringing back all the baby is eating? And vomiting continuously and not able to keep back food, or it's just that maybe it's bringing out a little bit, maybe after the baby has coughed a little bit, then maybe will bring out a little of the milk. It's very important that we differentiate, because if your baby is actively vomiting several times in a day, the baby is at risk of dehydration and all that, that baby needs to be seen by a pediatrician in the hospital. So in that case, you really need to take the baby to the hospital. But if it's just that baby is bringing out a little bit of milk, not actively, and baby is still otherwise eating well, sucking well, then if it's just cough and catarrh, then there's really no. I'm seeing a lot of cough and catarrh in babies who are less than 2 months old. This is the reason why we ask moms to exclusive breastfeed. Exclusive breastfeeding protects your baby against all this infection, respiratory tract infections. Exclusive breastfeeding protects your babies against them. So please breastfeed. Two, keep your babies away from people that have cough and catarrh. Especially when if it's already the rainy season, I don't know where you are living. If it's that period where children tend to have lots of coughs and colds, please keep your baby away from them. And this culture of everybody wants to carry newborn babies, everybody wants to kiss newborn baby, everybody wants to, it's wrong. These are where those germs are coming from. So keep them at home, wash your hands, keep visitors away from babies. Babies don't need visitors. You are the one that need the visitors, and you can go and welcome your visitors without carrying the baby. I know it's our culture that when people come, we have to give them baby. It's actually a wrong culture, because you are exposing those babies to germs. So please don't do that. So, but if your baby is really vomiting, take to the hospital. But if your baby is not vomiting, let's wait for the cough and catarrh hopefully will resolve, because most of them are like I answered. I believe you've answered my initial question. The initial answer I gave, most of them will resolve. Now, another thing you need to do is to, if your baby is just having cough but it's not having fever, it's not having difficulty with breathing, that does not stop the baby from taking immunization. I like the fact that you asked that question, because this is what we call missed opportunities. In other words, a child that should have gotten immunization did not get immunization because the parent did not go to the hospital because they believe that the child is having a particular illness or not. So there are illnesses that are absolute contraindication to immunization. Child is having high fever. Child is having like 39-degree fever, 40-degree fever. Yes, you can't go for immunization. But your baby is just having mild cough and catarrh and all that. Those are not contraindication to taking immunization. So this baby should still go for the 10 weeks, except the baby is really having serious respiratory infection, having difficulty with breathing. If the rule of the thumb, let me just give you a very simple answer to that. If your baby is not sick enough to be admitted to the hospital, then that baby is not sick enough to miss immunization. I think that's the easiest way to know. That's the easiest way I always give parents. If a child is not sick enough not to go and sleep in the hospital bed, then that baby is also not sick enough not to take immunization. So any child who is sick but is at home, is even if it's on treatment, that child can still go for immunization. But if your baby is very sick and we have decided to keep the baby on our bed in the hospital, those are the babies that really need to mix their immunization. So from obviously what you are telling me now, your baby is not that sick enough because you are not in the hospital. I believe you are home. So that baby can go for the 10 weeks immunization. But I want you to clarify the vomiting part, because I really want to be sure, because we worry about vomiting in babies. Actually, babies cannot take down food, they cannot retain food. That is serious. And that is the one that you need to let us know. Okay. All right. I hope that is clear. If you need clarification, just pop in more in the okay. Nana is giving me more
Nana,
information. Yeah.
okay,
So
Nana is asking, oh, she added information to a previous question. She's
yeah,
saying, please, is about weight. Oh, I
about
didn't
this
get
is
that part.
yeah. I guess
About
you
weight was 3 kg, and now
yes.
her weight is 5.7 kg.
It's not bad at all. It's actually usually babies double their birth weight at 6 months. So usually the baby should be about 6 kg at 6 months. But then I'm not really worried about 5.7 at 6 months. Seriously, it's just a little bit less. It's still within the normal range, if I can put it that way. So, but what I would just say is that so that the baby does not keep losing weight, let's start feeding. Keep breastfeeding exclusively. You didn't tell whether you breastfeed exclusively or not, but keep breastfeeding and start the complementary food. But don't worry, your baby will gain weight. If your baby is eating well, and you don't need to worry. But the weight is not so worrisome. I'm not too worried. Okay, so that's that.
Thank you very
Let's
much,
move on.
doctor.
Yeah.
Another Facebook user is asking, what triggers popular urticaria on toddlers?
Okay, so popular urticaria is one of those allergic condition. If I can put it this way, it's the equivalent of the asthma on the skin. So there are different parts of the body that you can have allergies. So you can have on the nose. So those are children having runny nose. We call it allergic rhinitis. You have the ones on the lungs, we call it bronchial asthma. You can have on the eyes, they're always itching, the eyes always brown and all that, we call it allergic conjunctivitis. So one of those one you can have on the skin is either atopic dermatitis or papular urticaria, in which case those children, when they are exposed to whatever they are allergic to, then they come up with this like what look like swelling on their skin, but it's temporary. It will come, it will look big red, and after a while it will just disappear. We call it urticaria. And anything can trigger it. It's vary from one child to another child. Some people is insect bites. So you see some children, as if mosquito bite them small. Most of us we have mosquito bite, you don't even see anything, you just rub it and go off. But for them, it will look so big and red. So insect bites can trigger it. Some children is just going through grasses, like they can, some children house dust, mites, there's so many things that can trigger, some people, some cream, some soap, Some people sponge. Some people is even water, like hot water or cold water, different things. So what we normally do is that as a parent, you just need to be observant to know what is the trigger in your own child. Sometimes we never even know the trigger because you keep all your observation, you never know what it is. Some people is some particular food. Once they eat that particular food, they break out with all those urticaria rashes and all that. So just be very observant. Once you know what it is in your own child, it's a very simple solution. Avoid it. Don't expose the child to it if it is possible. Some children it's difficult to avoid. Some people it just sunlight, for example. So you avoid whatever it is that trigger of the reaction. But the most common causes are actually insect bites, grasses, walking through the grasses, dust mites, and all that. So you just avoid them. Like you can wear long clothings for the child, clothings that cover their hands and legs and all that, like onesies if it's possible. And, avoid them being exposed to insect bite. Let them sleep under insecticide, treated mosquito. Just do what you can do. The good news is that as they get older, some of them tend to overgrow some of these things. Some people will still always have their allergic responses, but it kind of gets better. If the itching is so bad, some children will be so itchy and all that, then you may need to see a doctor or a pharmacist. They can give you what we call antihistamine. Like this are medication like Piriton, cetirizine that kind of reduce the allergic response. They are anti-allergy medication. So those are the things that you can use. I hope that's helpful. All right, let's move on.
Yes, now another Facebook user is asking, my baby is 9 months. His birth weight
is 1.8.
8. Is the
Yeah.
my baby is teething. He has brought out the 2 teeth at the middle bottom. Last week, only the head was warm. No other symptoms. I finished 1 bottle of Bonababe. For how long can one use Bonababe for a teething baby? Thank you.
Okay, thank you for your question. Number one, you don't need to use a Bonababe for the baby. Just go and throw away that Bonababe now. You don't even need it. Babies don't need any medication for teething. There's absolutely no need. I don't know why we call it, I don't know why we still have them, but there's really no need for you to use teething medication, whether Bonababe, Pecan, what other ones, the Baby Rex, whatever, Bomoro, all of them, just trash them. You don't need nothing. Teething is a normal developmental milestones. The same way you don't have walking powder, you don't have sitting powder, you don't have what other things the baby do, speaking powder. There's really no need for teething powder. It's normal for babies to grow teeth, so they don't need any teething mixture for anything. If your baby is having fever, give paracetamol. If the fever does not go, don't say it is teething. Take the baby to the hospital. It's one of the reasons babies die every year in Nigeria. When people come to us, Madam, this baby has been sick for 5 days and they're having fever. For why are you just coming? They told me it's teething. I've been giving teething powder. I've been giving teething mixture. This is the reason why babies are dying from things that we could have treated if you have only come on time. So please don't give any teething powder. Your baby was preterm, obviously, because your baby was 1.8 or your baby was small for gestational because you didn't tell her where your baby was born too early or not. But your baby's weight is fine because your baby is already, even at 9 months, already weighing 8 kilos, which is good. So please, head is warm does not even mean the baby is having fever. Babies said are usually warmer than the rest of the body, actually when they are eating or even when they want. So what you need to do, get a digital thermometer. Your hand is not a instrument. There's a reason why they decide to create that instrument, because we cannot always rely on our hands. So get an instrument. The thermometer is a digital thermometer. You know what, you can buy it in any shop. It's less than 1,000 naira. If you think your baby is warm, just put it. It will beep after like 2 minutes, and it will be written there what the temperature is. Normal temperature is 36.5 to 37.5. Anything above 37.5 is high. That means it is fever. So if it is like 38 or give paracetamol. You should always have paracetamol at home, and you can give. If you give paracetamol after, like, you can do it after 6 hours, check the temperature again, check whether it has come down. If it has come down, stop. Don't keep giving paracetamol forever. So if the temperature keeps coming back, it goes up, it comes down, the child may be sick from some other reasons, not because of teething. Teething does not make children sick. It does not cause diarrhea. It does not cause cough. It does not cause any of those things. So if your baby is sick, you give him paracetamol, your first aid as a mom, and if fever persists, please take the baby to the hospital, and we will do the right thing. Don't just say it's teething and all that. Please don't do that. So you don't need burner baby. You can trash it and just leave your baby alone, and you will see the teeth. Of course, because babies, when their teeth are coming out, it is bone piercing through flesh, so of the gum. So babies can feel uncomfortable. They could be a little bit cranky. They could be a little bit restless. They could be biting on people or biting on things on you when you are breastfeeding. Just be patient with them. Once the teeth is out, usually in 1 or 2 days, that's it. And some babies you will never even know. You will just wake up and you see the teeth there. So please don't give unnecessary medications. Number one, they are unnecessary. Number two, what is in those medication? It is under dosage of paracetamol, Phenergan, and all that. You can go and read what is written, what is in there. That's what they put together for you. And some children actually react to some of these medications, like the Phenergan and all those things that they put inside. Very dangerous. Some people put chloroquine and all those things together, which we don't even use anymore for treating malaria. So please don't expose your children to unnecessary medication. And like you have been doing now, some other will keep giving this medication forever. Some people will start giving from day one to maybe day year one. There's no drug that is safe, even that paracetamol. And that's why when you watch the adverts on the television, they will tell you after 2 days. We don't expect you to keep giving paracetamol even for more than 2 days. If after 2 days the child is not better, it means there's something going on. Go and see a doctor. Don't just keep giving drugs. By the time you give those drugs, you are damaging the organs of these babies. The liver, the kidneys, and all that. Even paracetamol can damage the liver if you give it too much. That is why we don't want you to give it unnecessary medication. Go to the hospital, let the doctors do their work. If baby is otherwise well, leave the baby alone. Don't give no medication. For pediatricians, the less medication you give, the better. Really, seriously, we, as much as we don't even want you to give any medication, we only need to give it only if it is absolutely necessary. So I hope that is helpful for this mom. And that I deliberately go overboard on it because all mothers do this. Most mothers do it. Let me not say all mothers. I believe ATB mothers are wiser now. So,
Yeah.
but I just want you to be aware so that you don't do that. All right, let's move on.
Gladys is asking, good
Mm,
evening, doctor. Please,
mm,
my baby of 5 weeks is always shaking her hands and legs while
mm,
bathing her. Her
mm.
birth weight is 2.8 kg.
This question is a little bit dicey because you said while bathing her, is it that the baby is shivering from the cold and all that? I really need to understand. If your baby because if it's only during the bath that your baby is shaking hands and leg, the normal thing I would think is that maybe your baby is being exposed to cold. So and babies may do that. So what we normally do is that when you want to bath baby, you must use warm water. Two, you must cover the head. It's better to do what we call segmental bath. You know what? So you first of all wash the head and dry it and put on a carpet. Especially if you are living in a cold environment, those of you who live abroad and all that, or even in Nigeria, maybe in the north, sometimes it could be very cold in the morning. So make sure you wrap your baby. Don't just expose your baby before the time for bathing. Make sure the water is warm. Then just carry the baby, remove the clothes, wrap, wash the head first, dry it, put a cap, then wash the rest of the body quickly. You wash them quickly and dry them using warm water, and then you wrap them and then you dress them up. If your baby is also shaking at all the time, what I would do is that thank God for technology. Everybody always have video camera phones. Take your camera, record that shaking because we need to be sure your baby is not having convulsions. That's the most important thing, to be sure that the baby is not having convulsions. So record that shaking and share it with us either on ATP if you want to, or you can show it to any of your doctors or your pediatrician, and we can decide whether is this shaking from cold or is it shaking from convulsion. Or some people also shake their hands when they're sleeping. which we call benign myoclonus, is just a normal, is not something to worry about. But they only do it only during sleep. But if your baby is shaking as throughout the day, or the eyes is rolling up, or your baby is becoming stiff and all that, that is more likely to be a convulsion, and that worries us, and that we need to see the baby immediately so that we can deal with it. All right, let me just quickly take another question from Instagram so that we don't forget Instagram members. Instagram, you are watching my laptop. Don't worry. I think so that way you can see the other moderator on our Facebook. Okay, so Shami for King is saying, my baby of 9 weeks was given formula for the first 2 weeks of birth because my breast milk took time to flow, but I now breastfeed only breast milk. Can it also be called EBF? Yeah, you can say you are doing EBF from now going forward, but you didn't do EBF for the first 2 weeks. But now, since you are now on on breast milk, so you won't say you do EBF for 6 months. You will say you did your EBF for maybe 5.5 months. So but you don't need to worry. The most important thing is that you are now doing breastfeeding, which is best for your baby. So I think that's what matters most, and that's okay. So keep breastfeeding exclusively. All right, I think that's all. I'm not having many questions from Instagram. Please, Instagram, ask a question. Let's go back to Facebook now. Let's move
Yes,
on.
another Facebook user is asking, my baby had discharge from the eyes from birth. The eye swab result shows there's no bacteria, but the
Yeah.
discharge hasn't stopped completely, although reducing.
Mm. So I guess your doctors must have given you some antibiotics. You didn't really tell us, because I believe for your doctors to have done an eye swab, they must have given some antibiotics. So if you're already using antibiotics before you do the eye swab, we may not get anything from the culture, because the antibiotics will affect the lab results, which is not bad. The most important thing is that if the eye discharge is reducing, I guess based on the treatment that your doctor is giving you, it's not to worry about. You didn't tell us the age of your baby. Always tell us the age of your baby when you're asking questions. So important for us to know which age. You just say from birth. So how old is the baby now? But just speaking, if you are worried about it, you can always see the ophthalmologist. That's the eye specialist. You didn't specify the age of your baby, so it's even difficult to know which, because sometimes it may take a few weeks for some babies for it to resolve completely. And more importantly, some things that mothers also do, when you are putting the eye drop, please don't allow the antibiotics bottle to touch the eyes, because what you do is that if you allow it to touch the eyes, you have introduced a germ into the bottle itself, and then you use it on the other eyes, you are creating more germs, and then it will be like a vicious cycle. Wash your hands, drop the eye. I know it's a bit difficult with babies, but it's just to, you may need help. Somebody open the eye, somebody just drop it from above. Like it preferably towards what we call this the part of the eyes that is towards the nose part. That's where you drop it, and it will just roll in, and that's all. And sometimes some of us will give you ointment at night, so when baby is sleeping, we just put the ointment. Since baby is sleeping, that will walk through the night, and that will be helpful. So but make sure you also wash your hands. Make sure you don't allow the bottle to touch the eyes, because that's the easiest way. And when you're cleaning the eyes, the discharge, don't just use any clothes, any water. When you clean it with a clean clothes and water, you wash your hands again, and and discard it, or wash the clothes and all that. So you take precautions to avoid reinfection, because if you don't do that, then we treat, then we'll keep on putting back the bacteria, then the infection will become a long one. But if it is taking forever, or it's taking too long, then we may need to see a specialist at times to take it over from there. I hope that's helpful.
Yes. Facebook user is also asking, good evening, doc. Please,
Mm,
my 9 weeks old baby has a swelling on the genital area. We
mm,
did ultrasound and it says
mm,
small bowel loops and
mm,
hydrocele. Please,
mm.
is surgery the only resort? And if so, can it be done now?
Yes, so if your baby has what look like hernia, because if you are having bowel loops inside, that means there's some hernia. So Anemia basically means there's a defect or there's an opening. So normally intestine should be inside the what we call the abdomen, and it should be lined up. So but if there's a opening along the lining, the intestine can come out of it and goes into the genital area. So that's what we call inguinal hernia. And the hydrosis just means there's also some water as well. So that's what it means. The solution is still surgery. It's surgery and it can be done. So just follow whatever the surgeon's advice. Depends. So it's not like it's an emergency, but if they feel that there's really no need to waste time, it's not a big surgery like that. It's a surgery they can do where your baby what we call with under local anesthesia, but sometimes if they want to repair the floor, they want to do under general. But just follow what the surgeons advise you to do, but it's not something to worry about. Yes, but the solution is still surgery. But you don't need to panic about it. It's not those kind of surgery that you should panic about because they are actually most of the time working outside, on this, not in the inside of the baby. I don't know how to explain that, but basically, it's just not something to panic about. That's just what I'm going to say. So just let the doctors do their job. Yes. Okay, I think this is an answer to a previous question. No fever, no fast breathing. If there is none, there is no need to worry. Okay. All right, let's move on. Wow, this is a long one.
Ineka is saying, good evening, doctors. Please, my baby is 8 months old. Birth weight was 2.5 and at 6 months was 7.1 kg. I noticed that she pulls at like 4 to 5 times daily, especially after each feed. But I'm worried is that she usually make that sound when stooling, as if the stool is hard. But the stool is usually watchy, but does not sink into the diaper. Rather, it draws like kata and has some small lumps like egusi. Sometimes the color is light green and brown sometimes. Please, what could be the cause and what can I do?
All right, thank you, Neka, for that beautiful description. Because what you have just described is a normal, perfectly normal stool in a baby. Baby make those sounds, but like I'm happy you also said that even though they make the sound, the stool is actually normal stool. It's not hard stool, and it's not like it's even diarrhea stool. So it's just a normal thing babies do. Sometimes some of them make those as if they are groaning sound and all that. There's really nothing wrong. It's just they are just conscious of the body or they're still coming out. It's nothing to worry about, and it's okay for baby to pass through up to 12 times in a day as long as the stool is not watery. It is also nothing to worry about. So there's absolutely nothing wrong with your baby's stool. The light green stool will worry me if because that may be a pointer that the baby is not getting enough food. So but your baby is 8 months, so your baby should be on complementary feeding. Please, complementary feeding is not just pap and milk. Complementary feeding is eating in different foods. So if you want to be sure your baby is getting enough, what's the weight of the baby? The baby is 7.1 kilo. Yeah, your baby is a little, you're not bad, but your baby could do better. It should be around like, oh, my moderator has disappeared. It should be around 7.5 kilos. So, but not to worry. So you just need to make sure that you keep on giving the baby the right food. But as regards the stools, there's really nothing to worry about. It's perfectly normal. You don't need to do anything about the sound. You don't need to do anything about the stool. That is all fine. Baby is okay. Just make sure you giving age appropriate complementary food. If you want more information about complementary feeding, you can go to our Facebook group and you go to the guide section, and we have a guide section on infants and young feeding, infants and young child feeding, about complementary feeding. So you can watch. We have videos. The advantage of those videos is that it tells you what to give, how often to give it, and all that. So that is what you really need to make sure you're giving to your baby. Otherwise, your baby is fine. Okay, I hope my moderator will come back. I guess internet went off. Okay, Orlin Phenomena is asking, my baby of 6 months is anemic. What type of food can I give her? Number one, what is the level of anemia of your baby? I believe, did you go to a hospital? Did they do a blood test? And what is the level? And also, as part of the blood test, we also know why is the baby anemic? What is the cause of the anemia. The reason is that that cause of the anemia is what will determine the treatment. And it's not just about food, for example. Of course, most anemia in children could be due to what we call iron deficiency. So if it is iron deficiency, we need to replace the iron. So the baby needs to be on blood tonic. Some could be due to folic acid or vitamin B12 deficiency. Some anemia may be due to an underlying illness. So if the child has an underlying illness that is causing the anemia, we need to treat that underlying illness. So we can't just assume that every anemia is nutritional. There are different causes of anemia. So this is the job of the doctors to know what is causing the anemia in your baby. And then they'll be able to tell you what is the treatment. And we need to keep checking to make sure the anemia is corrected. So you have not given me those information. I don't want you to just assume maybe because you think your baby looks white or something. No, if you think your baby is anemic, you need to go to the hospital. And the question we need to answer is number one, how severe is the anemia? For example, if your baby has anemia from sickle cell anemia, for example, food is not the solution. Iron blood tonic is not the solution. Okay, a child who has anemia from hemoglobin SS is a different. There's a different way to manage them. You should not give such babies blood tonic. So this is the reason why we need to know. So it's not a quick cut and paste kind of answer. We need to know how severe is the anemia. What is the cause of the anemia? That's the most important question to answer, and that is what we need to address. Give your baby normal food. You will give every other baby. Your 6-month-old should be on complementary feeding. And please, like I keep repeating, because we can't go into the details of all that, go to our Facebook group, go through the complementary feeding guides, watch all the videos, and then you will know all the how to feed your baby. But beyond the feeding, we need to know why your baby is anemic, and that is what we really need to be addressing. So if you have more information for me, phenomenal, you can still put it. If not, please, you need to see one of my colleagues so that we can really address this properly. All right. I think Lydia, welcome back, Busaya. I don't know what happened to the internet. Okay, so Lydia is can you hear us, Busaya? Busaya, can you hear us? Okay, I'm not so sure. She's still frozen. Okay, I think Lydia is saying reflux, so that's good. Cough and vomit like once or twice daily. You said it's and active. So I'm not worried about your baby. Go for your immunization, and we can just monitor your baby. When you go for immunization, it's also another opportunity to see your doctors anyway, so they can and do that for you. All right, let me go to Instagram while we're waiting for Busayo to be fully back because she seems to be frozen. Um, Perfect Style Beauty Place. Say, good evening, ma'am. Please, my baby or 6 weeks do breathe like she had cold, but nothing like mucus is coming out. I don't know her current weight. Okay, so it's not unusual for babies to have what look like noisy breathing. And this is one of the commonest questions mothers ask all the time. My baby has noisy breathing and all that. So the best thing is to really see the baby because we need to know whether you see a normal normal noisy breathing. I don't know how to explain it more than that, or is there something else? So some babies the reasons that some babies sometimes can have this breathing from the airway because their airway is not is soft, is flexible. And when baby's airway is flexible, they tend to have when hair is moving through, they have this noise. There's some noise coming through and all that, but there's really nothing wrong. And the baby is otherwise well, baby is sucking well, breathing well, eating well. There's nothing to worry about. And that's why ideally all babies should be examined by the doctors when you have your baby and at 2 weeks, then when you go for your immunization, so that they can check some of these things. But if you are not sure, because some noisy breathing can also tell us maybe there's a block, an obstruction somewhere along the airway that we need to do something about. So that is why it's best we see the baby. And some of you always post your videos, but then you cover up the baby and you want me to that. There's no way I can do that because to really properly examine breathing, I need to see the nose, I need to see the mouth, I need to see the airway. So in other words, the baby has to be unclothed. I need to see how the breathing goes in and out and all that. I need to be able to do it for 1 minute. I need to be able to count the respiratory rate for 1 minute. So most time people just send me 10-second video of the noise only, and I'm like, it's useless because there's no way I'm going to make out anything from that. So the best option is to see a doctor who can look at the baby, count the respiratory rate, listen with the stethoscope to be sure the breathing is fine. And if it's fine, they will tell you. If there's something for us to worry about, they will tell you, because breathing or noisy breathing can be a sign of either a problem with the airway or a problem with the heart. So we really always need to know that. So it's more important for you to be able to see a doctor and just to be sure. Okay, I'm still asking a question on Instagram. Udochi is saying my daughter had infection, was given antibiotics and paracetamol for 3 times a day. Today is the 4th day. She's not running temperature again. Should I discontinue the paracetamol? Wow, this is a lovely question. Yes, if your baby is no longer having fever, even though your doctor has recommended paracetamol, the paracetamol is recommended for the fever, really. So you can stop the paracetamol. So you don't need to keep giving the paracetamol. Most time, paracetamol, you don't need them for more than 2-3 days. But if your child was given paracetamol because of pain, for example, maybe a child who is in having pain crisis or someone who has an injury or something like that, then you can give the paracetamol. But if it's for the fever and the fever has stopped, you can actually stop as well. Thank you. Ijama is saying, please, my 10-month-old baby skin back is dry. Dry. Okay. Do you mean the skin? The skin on the back is dry? I guess that's what you meant. If that's not what you meant, please post the question, make it clearer. So what you need to do is to use moisturizer. So use moisturizer generously, no powder. I know mothers use a lot of powder on baby skin. They're actually unnecessary. Babies don't need powder on their skin because they are just drying up the skin. They need their skin to be moisturized. So actually some babies have what we call dry skin. So you need to use a lot of moisturizer and make it's generous. In other words, it's not like you use it in the morning and that's it for the day. You can always apply it, throughout the day as well, as often as possible. But preferably let it be something that is what we call hypoallergenic. Hypoallergenic means it is not it doesn't contain lots of chemicals. It is something that's not likely to irritate the child's skin. So things like your Vaseline, things like your Sebamed, things like your what are the other ones? There are a lot of those products. They always write it on them when you go to the shops. They always write dermatologically tested, hypoallergenic, and whatever. For babies, you can use those ones. So, but do it frequently and don't do powder. The commonest reason most baby skins are dry is the powder that parents are applying. So they've done the cream, but they will still put powder on top. It's really not necessary. You can use oil, olive oil and coconut oil. Those are fine. All right. I hope have okay. Okay, Shami is saying, how do you know when a baby is having diarrhea? Lovely question. When a baby is having diarrhea means that the baby is passing watery stool. And because newborn babies and babies still on milk, their stool is actually not hard anyway. So it's usually like semi-formed in the first place. So that's not diarrhea. So, but the diarrhea stool is the way we normally describe it for parents are any stool that takes the shape of a container. Any stool that take the shape of a container, that's diarrhea stool. In other words, it's like liquid, it's like water. But these days, most of us are using diaper. It's a little bit hard. So what you need is that if the stool sink completely into the diaper, as far you cannot see anything on the top, it's all in the diaper like a urine, then that is most likely a diarrhea stool. Otherwise, any stool that is watery, take the shape of a container, and the baby passes like 3 times in 24 hours. That is what we call diarrhea stool. Okay, so that's how you know the stool is watery, it's diarrhea. And if there's blood, then we call it dysentery. In other words, it's a watery stool and you also have blood in the stool, then that is dysentery. So that I hope that is clear for you. And usually it has to be like 3 times in 24 hours. So we always say one explosive stool. But I guess most parents may not flow with that, but I guess that's helps. Okay, Kosi is saying, what is our Facebook handle? Our Facebook handle is Ask the Pediatricians. You can't mix ATP on Facebook. ATP is one of the most most popular parenting group on Facebook. So it's just Google Ask the Pediatricians on Facebook, and you will see. And we can see all our handles all over on our page everywhere, or go to our bio, you will see our handle there. So but once you go to Facebook, just look for Ask the Pediatricians. That's like about 690,000 people. Yeah, then you know you're in the right group, because there are some spin-off groups. But if you are not seeing Ask the Pediatricians with the 690,000 members, that is not our own group. So it's a group you will not mix on Facebook. So it's the same. Our name everywhere is Ask the Pediatricians, on Facebook, on Instagram, on YouTube. It is on YouTube is ATP TV. So, but it's very easy to see us. If you later on, we can give you the link, or check our our profile. All right, Tessirisa, I hope I got that name right. Is having issues with noisy breathing for my 5 weeks old baby, but I'm clear now with this explanation. Oh, okay, thank you. I guess that's just uh I want to ask, can a drug like paracetamol can be reused after a month? Okay, this is a question people ask all the time, because all of us buy paracetamol, keep it in the house, and then you use it for 3 5 days, then you don't need it anymore. Then another 1 month, you need paracetamol. Actually, the pharmacists have answered that question. The pharmacists don't want you to keep paracetamol beyond 2 weeks. They want you to trash them. I know it's hard, because you see, I have half a bottle or full bottle, but really they don't want you to use liquid for more than 2 weeks. So if you read the leaflets, all the leaflets also has that information. They will tell you once opened, use within certain number of days, or trash. So I think our pharmacists have answered that. The reason is because once you've opened medication, even though you keep it in your fridge, bacteria and all those germs, they can come inside them. And so you are giving paracetamol, but you're also giving bacteria culture. So we don't want that. So as much as possible, use whatever you want to use, even though it's painful, trash the rest after 2 weeks and buy a new one. And always check the expiry date as well. So even though it has not expired, as long as it's opened, you have to be conscious of that you have to trash them. It's not as if they won't work again, but we are worried about the fact that they could have culture of bacteria inside them. Okay. Somebody say, okay, I have a question. My 23-month-old doesn't pull warm when you give warm. That is fine. Because remember, you're only deworming the child. It doesn't mean the child has worms. And sometimes the deworming is not even for the worms, the big worms. It's for what we call the eggs, the larvae, the ones that you can't even see, that will later develop into the big ones. So it's okay. We don't want your baby to have worms. The idea is that you are doing prophylaxis. In other words, you are preventing them from even having worms. So it is perfectly normal for you to give worm medication and not to see worms. Because if you see worms, what you need is not the deworming. What you need is treatment for the worms, and that treatment is different. So for most deworming medication, you just use one medication 1 day, and that's it. If your child already has worms, we usually will treat them for 3 days, then we will treat them again after 2 weeks. Whereas if you are just deworming, you give it now, then it will be 6 months before you give another one, because it's a prevention kind of a thing. So it is okay if your baby doesn't have worms, there's no worms to pass out. But if your baby has worms, it means our deworming process has failed, and then that means we need to even treat the worms. And usually the treatment is different. Usually we will give that same medication for 3 days and maybe repeat it after 2 weeks and all that. So there are two different process. There's a deworming, which is to prevent worms, and there is actually treatment for a child who already has worms. So those are the ones that you actually see the worms physically, because they already have the worms. So I hope that is helpful for perfect style. All right, I think we go back to Facebook now. Okay. Okay, let's go back to Facebook. I'll come back to Instagram. If not, Instagram just on fire now. Instagram is on fire now. Have we answered this question? Yeah, okay, I've answered the
Yes,
question
we've answered that.
by Neka. Neka, I hope your question is clear. Yeah. Okay, I think we've answered this question. Or lean phenomena. Okay, I've answered this one. Okay, I've answered. Okay, yes, I answered this one when you were off the pen. Okay, so let's go back to Favor now. Yes. Okay, let's continue from Favor.
Favor is asking, my baby is already 8 months old and she's not taking any food. What can I do about it? Because it's getting me worried. Birth weight 3 kg and current weight 5 kg.
Wow, Favor, your baby. I was actually going to ask you before whether are you exaggerating, because when mom said the baby is not taking any food, and I'm like, you mean the last 24 hours the baby has taken no food at all, like nothing, not even breast milk, nothing. I mean, nothing, like fasting, nail by mouth. But now looking at the question, looking at the weight of your baby, I'm actually worried about your baby, because your baby should be weighing like 7.5. Your baby is weighing 5 kilos. That is quite severe. You really need to you really need to go to the hospital, because your 8 month old is weighing like a 3 month old, or even like a, yeah, more like a 3 month old, and that worries me. That is, we call it malnutrition, and it's severe. It's actually severe. So you really need to go to the hospital now. Like, this is not even a what food should you give. This is a baby that has already crossed over to what we call malnutrition state, either malnutrition or failure to thrive. I don't know. Malnutrition means the baby is not gaining weight because the baby has not getting enough food. But some baby may fail to thrive because they have something going on, like a medical condition. And I'm curious, have you been going for immunization? Who has been seeing your baby? Because if your baby was 3 kg and baby has only gained 2 kilos in 8 months, we should be screaming something is wrong somewhere. And so really, I don't know where you are, which part of the country you are. If you want to, you can let me know. But you really need to go to a pediatrician. You need to go to an hospital that's a pediatrician, like now, like as I'm talking now, like now. Seriously, I'm not joking. You really need to go, because your baby really needs to have what we call resuscitation and rehabilitation. We need to get the baby back to the normal weight. Then we can now start talking about how to maintain it, which is the question you are asking. I know you are worried. I'm also worried about your baby, because this baby's weight is really worrisome. And if you were exclusive breastfeeding and your baby was not gaining weight, you should have seen one of us. It's 8 months. Your baby should be gaining 1 kilo like every month. So if your baby has only gained 2 kilos in 8 months, I'm worried about it. So um if you let me know where you are, I can link you up with the right hospital. I know the teaching hospitals, the federal government hospitals are on strike right now, but the state hospitals are working. So please, this is a baby that needs to go see a pediatrician like now, like yesterday. This baby needs to go to the hospital now. So please, um, you need to do that now. Okay, this baby needs to be in the hospital, not even on Facebook. Like, we need to admit the baby. If I'm seeing your baby, I'm admitting your baby. I'm keeping the baby with me. I'm resuscitating the baby. We're going to feed the baby. We're going to make sure the baby gain weight first, and then we will now tell you how to continue after you have discharged the baby, after we have resuscitated. We need to be sure there's no medical problem that is keeping this baby not gaining weight. So that's the issue. And this is just a general advice to all the moms watching me. Please, if your baby is not gaining weight, you need to see a pediatrician. It's not a matter of, oh, baby is not eating, baby is not eating. No, you have to see us. There are sometimes your baby is not gaining weight. Like, somebody will say baby is not gaining weight. Maybe it's 3 kilos at 6 months, maybe it's already 5.7, which means maybe it's almost doubling. That is the kind of one that I was, okay, let's give this, let's give that. But if your baby has really gone, and that is why you have your immunization card, and in that card there's a weight chart where you plot the weight of your babies. Ideally, each time you go for immunization, they are supposed to be plotting it. And there are lines. If your baby is falling below the line, if your baby is dropping below that line, you need to be admitted. We call it danger sign. It's a sign that something is wrong. We need to do something now. Because if not, we may lose that baby. So we really need to act fast. Seriously, we need to act fast. So please, if your baby is not gaining weight, it's not a good sign. If your baby is the same weight, we worry, but we can still do something. But if your baby now starts to lose weight, then that is serious. So please don't take it lightly. If you tell me where you are, I can see how to escalate you to the right people. This is beyond Facebook. This is something we have to do offline now. So just give me that if you want to do that. But if not, please just find your way to the closest hospital now. Preferably the
Let's
one with
quickly answer this.
yeah, go on. Yeah.
Another Facebook user is asking, good evening, ma. Please, should I bath my baby after his third immunization?
I'm not sure I understand why this is a question. In other words, is it like immediately after the immunization, you need to give your baby a bath? In other words, your baby has already had a bath in the morning, and then after the baby has got immunization, do you want to give a bath? There's really no need. Most babies just need once a day bath. Okay, so babies go for immunization in the morning. Before they go, you've given them a bath. There's no need to bath them when they come back. That's what I mean. If that's what you meant. But if it is the fact that maybe after immunization the following day, should you bath or not bath, you can bath the following day. So that's fine. I hope if I really want to understand the what is in your mind so that I know what to answer you. So please don't give a bath after the immunization. If your baby has fever, give paracetamol. Be very gentle with the legs. You know, when they give the immunization, that's 6, 10, and 14 weeks immunization, the legs are very sore. So that's not the time to be putting the leg up and down. You want to put diaper, you just throw the leg up and down. It's very painful. And I see that some mothers are not very conscious of that. And then they're like, baby is crying. So you be gentle. You undo that legs gently. And that's even the reason why you don't need to go and be giving unnecessary bath. When you're changing diaper, you can put ice pack. If baby is very cranky, you can put what ice pack basically means just get ice block. Wrap it in an handkerchief, tie it together, and just put it on top for a few seconds, maybe 10, 20 seconds, then you stop. After a few minutes, you come back, you put it again. You keep doing that. That's all you need to do. You can give them paracetamol every 6 hours. Make sure you give the age appropriate dose. Check the weight of the baby or check the age of the baby and give the appropriate. It's not 0.3, it's not 0.6. That's not the appropriate dose of paracetamol for a 14-week old. So please make sure, if you don't know, just ask us, or native people will tell you. So you give them. Usually between 2-3 days, most babies will be fine. So that's all. I hope that is helpful. All right, let's move on.
Yes. Favor. My son is 3 years old. He's been coughing for over 2 months now. And he has taken antibiotics and malaria medication, but he's still coughing. He also vomits a lot, either while eating or immediately after eating. Birth
Okay.
weight 2.5 kg. Oh, that's the same Favor.
No, it's the same Favor, but this is a different baby. This is a 3-year-old, and this the old one is 8 months old. The second one is 3 months old. At 3 years
All
old,
right.
Favor, I'm worried about both
Okay.
the children. I'm worried about both of them. And now I'm getting clearer picture of what is going on. Your baby who is coughing for 2 months, that is chronic cough. And your baby is not your 3 years old is also very underweight. It's also severely underweight. Your 3-year-old should be weighing 14 kilos. It's weighing 10. 10 kg is the weight of a 1-year-old. So there is something going on with your children, and I'm really worried about them. So please take both of them to the hospital. It's seriously. So please, if you want more information, you can reach me on our Facebook group. But your 2 children need to be to the hospital now, and they need to see a pediatrician, because 2 months cough is too long. They need to do X-ray. We need to know why. We need to rule out tuberculosis. That's basically where I'm going. We need to rule it out and all that, because any cough that is more than 2 weeks, we call it chronic cough. And if baby is also not gaining weight with chronic cough, those are the things that we will think about. So I'm not saying that's what your baby has. Remember, I've not seen your children, but I really want you to go to the hospital now, like now, and let me know. Let me know. I'll track you maybe on Facebook later. Let me know what happens, which hospital you have gone, so that we can make sure
Okay.
we're getting the right support. Yes.
Yeah, another question here. Yes, doctor. I think this is like a follow-up to
These are
the
the follow-up. Yes. No
initial.
fee.
Yes,
Okay.
no fever, no breathing fast. She's on exclusive breastfeeding and gaining weight steadily. Birth weight 4.3 and current weight 6.3.
So no need to worry. No need to. I can't remember which one of, because you are Facebook users. So I've seen many Facebook users. So I don't know which of them is yours. But what you've told me basically is there's no problem. So just go for your immunization. If you are the one asking about immunization, go for your immunization. You don't need to go to hospital. You don't need to give antibiotics if you are the one, because I'm really confused which of you now. but you know yourself, so just don't worry. Yeah, and it's a follow up. It's a response to my answers before, so I understand that. Yeah.
Now, Carol is asking, I have a 2-year-old son and he's always constipated.
Mm.
What would be the best diet for him?
Okay, the question is, why is your 2-year old always constipated? Constipation is hard stools and difficulty with passing stools or infrequent passing of hard stools. So it's about the food you're giving. So the baby needs to eat a lot of fruits and vegetables. Fruits and vegetables is very important, and drink lots of water. So you give water, like a 2-year old should be taking not less than at least 1 to 1.5 liters of water every day. Drink lots of water. Fruits, vegetables, very important. Food that are rich in fiber, very important. And let them also learn to have good bowel habits. So first in the morning, your 3-year-old wake up, let him sit on the potty. So you move, because I'm not saying that some children are playing and they don't want to go to toilet. So even when they feel the pressure, they will not go. They want to keep playing. They don't want to go. So you have to teach them how to always move the bowel. Usually, and if they move the bowel once in a day or once every other day, that's not bad. But most importantly, but if the baby is already constipated, we need to treat that constipation first. We need to let that old stool come out. So you may have to see one of the doctor. They will give you what we call medication for constipation, like lactulose or paraffin and all those kind of things, so that the one inside will come out first. Then we now need to work on avoiding the constipation. So that is drinking water, eating food that are rich in fiber, fruits, veggies. Take off all the junks, all those pastry, biscuits, all those things. Take them off, and the baby will be, and then get them into habits of moving the bowel regularly. So I hope that's helpful. All right, I think our time is running. We need to rush now.
Mm.
So we'll not take any question that comes in after 7 anymore. My goodness,
It's past 7.
oh my goodness, we have so many questions already. So we need to rush now.
Yeah.
Um,
Please, what is the cause of fast breathing with heavy sounds from a newborn baby? He breastfeeds well and has no fever.
when you say a newborn baby, like a newborn baby day 0 or day 28, I need to know. Because if your baby is a newborn like day 0, the baby should be in the hospital. The doctor, there's the cause of fast breathing in day 0, and there's the cause of fast breathing after. And then what do you mean by fast breathing? Did the doctor count the respiratory rate and say it's fast? Babies usually breathe faster than adults. So their normal respiratory rate is 40 to 60, whereas you and I will breathe 12 to 14. So when mothers say baby is breathing fast, it may still be normal breathing for us. So we need to know. That's what I'm asking. Is your baby a newborn baby, like in the hospital now, so that the doctors will be the one to check it for you? So if you think baby is breathing fast, let a doctor, a nurse, count the respiratory rate for 1 minute, so that we don't start looking for what is not lost first. So we should count, and it's more than 60 in 1 minute. Then pediatrician need to see the pediatric causes. It could be a problem with the lungs, it could be a problem with the hearts, it could be even like infection on that. But I don't think your baby is breathing well, your baby doesn't have fever, look like a healthy baby to me. Looks to me like maybe you're the one that doesn't understand what is fast or what is. So I really want a pediatrician to confirm, or a doctor, any doctor or nurse can confirm that for you, and then we can take it out from there. All right, let's rush through our
Good
questions.
evening, doctor. Please, does lymph node appear in other parts of the body apart from the back of the hair?
Yes, there are lymph nodes everywhere. There are lymph nodes for your ears, there are lymph nodes in the neck, there are lymph nodes in the armpit, there are lymph nodes in your groin, there are lymph nodes everywhere. So, and it can be swollen anywhere where the infection is. So yes.
Oluwatosin is asking, hello ma, please something strong hit a baby of 1 year, 3 months on the head. But after breastfeeding, he stopped crying. Is there need for worry for the mother?
What is it? Something strong that hit the baby? We need to know. And check, you need to monitor the baby first. Make sure, like, we need to be sure the baby doesn't have any head injury. That's basically the most important thing. So number one is the baby passed out, the baby stop, become unconscious. Monitor the baby vomiting, the baby become like not active like before and all that. So if you notice anything different, so it is too early now, but if you notice anything different in the baby, you need to take the baby to the hospital. If there's bleeding from the ears, bleeding from the nose, or water, something like water coming from the ears or the nose, or any obvious wound or anything like that, or the baby start having convulsion, or the baby passed out. So this baby still need to be monitored for the next 24 hours, not minimum, to know to know there's no other injuries. If the baby is otherwise fine, no, none of those things I've mentioned, then that's fine. But if you notice any small change, like baby is just sleeping too much, baby passed out, fainted, baby is having convulsion, baby is vomiting, you have to take to the hospital, because that may be sign of head injury. Okay,
Thank
but
you very
please
much,
keep my
ma.
baby safe from all those kind of injuries.
Rita is asking, can I feed my baby of 7 months solid when they wake up at night?
It's better you breastfeed at night, because your 7 months old should be on like two complementary feeding a day. That's all. The rest of the food is should be breast milk. So people think when they start complementary feeding, the baby should be able to taking solid. No, this is why I keep saying you guys need to watch those complementary feeding videos, and you need to go to our Facebook group and go to the guys section. A 6 to 7 month old, you just need to take 2 to 3 times complementary feeds in a day. The bulk of the feeding is still the breast milk. So you can do that solid in the day. You can do it, during the daytime, and then breastfeed. It's better to breastfeed through the night. So that's best.
Yes. Hello, doctor. Good evening, ma. Please, my baby is 3 months today, and birth weight was 2 kg and now 6 kg.
Good.
Please, doctor, my son's stool has been watery, yellowish, but kind of greenish for 2 weeks now. And I took him to health care center, and the doctor prescribed zinc, ORS, paracetamol syrup, Maxiclav, 228.5 powder for oral suspension, and Clautem suspension, anti-malaria. I have given him all these drugs for 5 days now, but no improvement. Please, doctor, my baby's stool is still very watery and frequent, like 8 times a day.
For me, your baby don't need any of those medications to start with in the first place. That's the truth. Your baby need none of those medications. Are you on exclusive breastfeeding or formula? I didn't get that
She
clear.
did state that.
Like, the most important information I need is to know how you're feeding your baby, because your baby obviously is gaining weight well, because your baby was 2 kilos and it's now 6 kilos. So your baby has diarrhea, doesn't need antibiotics, doesn't need no. I didn't hear you say your baby has fever. So I don't know why we're giving anti-malaria. I didn't say you say they do any blood tests. So I know some doctors, once you go to them, remember that when you go to some of the doctors, they use what you tell them. So if you tell them your baby has watery stool, because if you have told me your baby has watery stool, I would have asked you, did the baby is the stool sinking that completely into diaper, blah blah blah. I had some more questions to clarify, because some mothers will say my baby has watery stool, whereas baby doesn't even have any watery stool. It's just a normal semi-formed stool. And if your baby's stool is greenish, are you breastfeeding adequately? That is what we need to ask. Maybe getting enough food, because greenish stool may be a sign of starvation stool. So these are the kind of question we need to ask. So sometimes when you give some drugs, you actually worsen, like some of this diarrhea, like you're giving augmentin. One of the side effects of augmentin is diarrhea. It's going to give your baby loose stools, and your baby is already having loose stools, then you are going to make it worse. So for me, I don't really know. We need to know what is wrong with your baby. So for example, if your baby is not having fever, how are you feeding your baby? So if your baby is not having fever, the baby does not need no antibiotics, no anti-malaria, nothing. So just stop all those. So anyway, you've given them already for 8 days, I guess, and your baby is still having watery stool. So please stop all the medications, stop all of them. Just breastfeed your baby. That's all. Exclusive breastfeeding. Don't even give this ORS anymore. Usually, we will not give a baby of three. How old is the baby? 3 months old. Yeah,
3 months
you're
today.
3 months old today. So which means that you did this one like about when your baby was not even 3 months old. Will not give that baby ORS at less than 3 months old. So your baby just needs to take breast milk only. Breast milk only. That's all your baby needs to take. And don't give no other medications. Even if you are given before, like you were given all those multivitamins, all those other things, they will make this too watery as well. Give only breast milk. If you give only breast milk, your baby's stool may not be hard, solid. It will be semi-formed like a goosey soup. That's the kind of stool. And that is normal stool. And it can be up to 12 times in a day. That is still normal. That is not diarrhea. So that's all your baby needs to take is breast milk, no medication. When you give medication, sometimes you add more problems to what is not, you are looking for what is not lost. That's the issue. So that's why sometimes I always say for babies or newborn babies, especially your baby who was already 2 kilos, who was small, it's better you see the pediatricians at times so that you don't just, because some doctors sometimes treat both the adults and the children the same way, and it's not. So it's not the same. And we don't just jump on medications all the time for what is not lost. So most diarrhea in children don't need no antibiotics, no drugs needed. So if your doctor is suspecting malaria or infection, they should do a blood test first. It is only the blood test say there's infection, there's fever, there are other things. I didn't see any of those things. All I see is my baby has stool, watery, yellowish, greenish for 2 weeks.
Yes.
So, and then the next thing is we have given so many drugs that are unnecessary. Anyway, I would just say stop everything and just give breast milk only and watch your baby. The only thing that worries me is your baby is vomiting, your baby is not taking the breast milk, then you have to go to see a pediatrician who can admit your baby. But if your baby is sucking, your baby is not throwing up, then there's no need for any of those things. You just need to make sure keep breastfeeding frequently and hygiene. Wash your hands. Wash your hands very well. Don't give baby any other thing else. Don't give any other medication, native, ABBA, whatever. None. If you're also taking any medication yourself, watch, because your own medication can pass through breast milk and affect your baby's too. So those are the things you need to pay attention to. I hope that will be helpful. If you need more help, of course, you have to see a pediatrician. But I think if you stop all those medication and just breastfeed, your baby will be fine.
Someone is asking, please, my infant of 16 weeks weighed 4.5 kg at birth and weighs more than 10 kg now. How
Wow.
do I reduce the weight?
Oh,
Is
wow.
on EBF. Thank
Wow.
you.
You need to see a pediatrician. There's something going on. Your baby is too big. Your baby, this is, yeah, somebody was asking about our baby being too big. This is a classical example because the moment your baby was big from birth is 4.5. That is what we call big baby, large for age baby. Any baby group 4 and above is large. Now your baby has already doubled the birth weight at 4 months. Usually they double at 5 to 6 months. So your baby already double at 10 kilos. Keep breastfeeding exclusively, but I really need you to see a pediatrician to be sure there's nothing else going on with the baby. Why is the baby big? Why is the baby gaining weight? We need to make sure there's no other um medical conditions. That's what I mean. I know that we want our babies to gain weight well, but too much weight is also not good for the heart. It's not good for the baby. So we need to be sure there's no problem. I'm not saying there's a problem. I hope you don't misunderstand me, but I really need to be sure there is none. So the pediatric endocrinologists always want to see babies like this that are gaining weight too rapidly so that we check that there's nothing. And if there's something, we do something about it. If there's nothing, we'll just keep breastfeeding and we monitor. But if there's something, we want to do something about it. How that's helpful. I don't know. This person is sending us. Okay, I guess this is the person that asks about the newborn baby breathing fast. Okay, I told you what to do.
Yeah,
Yes, just let
16
somebody,
days.
let's say a professional check the breathing first. Baby can breathe fast to parents, but they may not necessarily be breathing fast to a professional, so that's it.
This person is
Okay.
asking, my son of 3 years, 8 months is yet to identify letters and figures. He talks, but I don't know if what he's saying is age appropriate. Should I be worried? He's also hyperactive.
Yes, you need to see a pediatrician. You need to see it. We need to assess this child development. I'm not even worried about the letters, but I'm worried about the speech, and I'm worried about it being hyperactive. We need to check. We need to assess this child because you should be able to understand what your 3 year, 8 months old. You, the mother, should know what their child is saying. If a stranger is saying, I don't know what the 3 year old is saying, maybe I will not worry so much. But if a mother doesn't know what a 3 year old is saying or whether it's appropriate, then I worry about that. A 3 year old should be talking sentences. It's almost 4 years old, so you should. If you want to book a developmental assessment, you can book with us on ATP. But your child definitely, or you can go see any pediatrician. Your child is. Please don't go to people that will tell you there's nothing wrong. please go to people that will actually assess your child properly. I have my reason for saying that. So just be careful where you go. So you may want, unfortunately, our hospitals are on strike now, but if you want to
Good
assist
day,
me,
doctor.
that yeah.
I want to know how to care for my infant vagina. I'm a first-time mom. Can I use soap?
You don't need to care for vagina at all. There's nothing like caring for vagina. So you, number one, what you see is not what is called a vagina. What you see on the outside, we call it the vulva. The vulva, the female genital, the part that you can see is called a vulva. What you can, the vagina is actually on the inside, is the is on the inside way. So, and you don't need to, you have no business with these things. What you need to do for the vulva, the same way you wash the hands and the leg, is the same way you wash it on the surface and rinse it the same way you rinse every other part of the body. You don't need to do nothing. You don't need to press anything. You don't need to put any powder. You don't need to press any. What else do people do? All sorts of things people do. You don't need to put anything on the
Pressing of the
inside.
clitoris.
You don't need to circumcise the female. Just leave it alone. Just wash your baby. Wash it the way you wash the abdomen. Just wash on the surface and rinse your baby and dry your baby and put cream around your baby's body. That's all. You don't need to do nothing to the vagina, the vulva, all the female genital tracts. There is nothing for you to do to them. I know why I'm saying this because I know there are some mothers who are sitting on this table. They have to press it. They have to, now that they don't, because female circumcision is now illegal, it's a criminal offense. Some people they say they are pressing it down or whatever, or putting powder, all those nonsense. Please don't do nothing. Just leave it alone. That's all. When you
Thank
wash,
you
when
very much, doctor.
you can wash the area with water, and that's all. Put your diaper cream before you put your diaper. That's all. You don't need to do any special thing. All right, let's move on
Thank
quick.
you.
Oh my goodness.
Oh, this is like a follow-up. Also, he breathes as if there is cough in his throat. Although his breathing is normal and he feels well, what do you suggest I do?
If
I
you are
think it's
worried
still
about
a
your
follow-up.
child's breathing, you need to see a pediatrician because you say it's breathing that is cough, but you also say the breathing is normal. You are not the one to decide that. Let a doctor see the baby and decide. If a doctor see your baby and say, "Madam, this breathing is fine," then you can relax because I can't examine your breathing now online, so it's better. So when you are asking your
Okay.
question, try and put everything in one post. If you put it separately, we won't know who is which one, so we won't be able to.
Okay.
Yeah. Okay, yes, we've answered your question.
Someone,
Sorry. Okay. This is a woman
this
that
one
said,
too is like a follow-up too.
yeah, we use it for 3 days. She was given chloramphenicol. Yeah, I understand. I know this question. Um, we don't recommend chloramphenicol eye drop anymore for children below 2 years, so I'm not comfortable with that. And so she was not given medication for the eyes. The eyes is not infected. Okay, it's only one eye. Okay, I feel the eye is. So if your baby is still having high discharge, please see the doctor. Number one, the treatment is not even usually 3 days. When we give your baby eye drop, usually like 7 days, 10 days, or 2 weeks. It's not usually 3 days treatment. But we also don't like to give chloramphenicol eye drop to babies less than 2 years old. So if your baby is still having high discharge, the doctor will do the eye swab. You can go back to that doctor and let the doctor tell you what next to do. I think that's just the follow up to that. All right, let's move quickly. Mm.
Okay. Aluma is asking, hello, doctor. My baby of 19 weeks was sick some weeks back and he refuses to take breast. His doctor recommended formula and akamu. He's fine now, but question is if I can continue with EBF. Birth weight 3.4, current weight unknown. Thank you.
I don't know which of the doctors recommending Akamu to baby less than 6 months old. That is wrong treatment. Your baby is not taking breast milk because baby is sick. We understand that. Poor feeding and all that is part of the illness. So now that your baby is well, just keep breastfeeding your baby. When your baby is 6 months, you can now start complementary feeding. That's what. And I'm surprised you don't know the current weight of your baby because your baby has just been to an hospital and they treated your baby and you still don't know the weight. So that means they didn't even check the weight of your baby at the hospital. There's something going on there. Is it the same question? Yeah, I think it's the same question. She sent it twice.
Yes.
Okay, she sent it twice. I don't know. Somebody is calling somebody. Okay, I think I'm just going to rush through the question myself. Sorry, let me not allow you
Okay.
to read so that I can just skim there because we're not going to leave it tonight. It's already 7:30. I can assure you say 3 months. So yeah, okay, we've answered this question already. It's the same question. Yes, okay, she's putting it together. Akin Obatosho Modupa, you need to see a developmental pediatrician. Your baby needs to be assessed. We need to do a developmental assessment and then we'll tell you what next to do. Alade Goroye say baby is 5 months, high fever, coughing, pooing, third time today, vomited. You need to take baby to the hospital. You need to take the baby. Baby is having high fever, is coughing, is vomiting, is stooling. Baby is sick, and unfortunately, we cannot treat this baby on Facebook. We have to take this baby to the hospital now. Please do quick. 3 months old is having fever for 1 month. Wow. Now we have gone to the hospital. Yeah, she was treated. Temperature is still high. We went back to the hospital. She was given quinine. Yes. Fever is still there. Yeah. So your baby needs to go see. Your baby needs to go to a teaching hospital library. Your baby has had fever for 1 month, and they've treated properly, treated with anti-malaria antibiotics. So your baby may have what we call persistent fever, fever of unknown origin. We are not sure. So we need to look for things beyond malaria and infection. So we need to look for other causes. So that is not something that some hospitals can handle. Usually that is something that you have to see the specialist for, pediatrician at the highest level, because we need to look for other causes that we may have to treat. Okay, Neka is asking, okay, you've done that, good. My baby does not like to take fruits, especially avocado, pear, banana. She vomits heavily in the middle of the night. You don't need to give her those things. You don't need to give what your baby does not like. Just try whatever the baby likes. So there are ways to give fruits. I'm not sure what your initial question was. Was it the one on constipation, Neka? Let me look back. I can't remember. It's always so hard to remember now. Let's go back. Is it about complementary feeding or is it about fruits or constipation? Yeah, Ineka, yeah. Yeah, okay. Yeah.
It's about the constipation.
We're not worried about your baby at all. We're not worried
Okay.
about it. We say your baby is
Okay.
fine. Just keep
It's
feeding. That's all.
fine.
So don't give what your baby does not like. And also watch the quantity. I think sometimes about quantity as well. Don't give the same quantity you will finish. Some of these things you give a little at a time, like snack in between. You don't have to if you give them, overload their tummy, they may not digest it on time and then they may have issues. Another Facebook user is saying, my niece is 13 months, she has anemia, she was born preterm. Yeah, the thing is she throws up a lot, usually at night. It can happen at least once in a week. She's been to the hospital, doctor says indigestion, giving me smart vinegar. Why has the hernia not been operated now? If your niece has a hernia, has it been operated? Why has it not been operated? That's the first question. I can't really say whether the vomiting is due to indigestion or hernia because I need to ask you lots more questions. But if your baby has hernia, and this is 31-year-old child should be operated. It's too long. And please don't give the baby Pinsmag and Rofegan anymore. That's not appropriate. That's not appropriate at all. And if baby is throwing up a lot, baby should be seeing a pediatrician. Yes. And yeah, if the hernia is the one causing the vomiting, there will be other signs in the hernia side itself. The hernia itself will be big. It will not be going down when you press on it and all that. So we need to know. There are many reasons why your baby could be vomiting. So I won't want to make an assumption. So surgery is needed for hernia. If a child has hernia and there's only one solution to hernia is surgery. No other solution. If it's not going by itself, it is surgery. Okay, somebody said
Your question has been answered.
if answer your question, we are going step by step, so we will not jump your question. I don't know who is Rolly. I don't know what was your initial question. You said you're in Port Harcourt. If you're in Port Harcourt, maybe if I was going to recommend an hospital, maybe I would say UPTH or those kind of hospital. or the state hospital. I'm not sure what your initial question was. Sorry, now I'm forgotten. Komalafe, my baby is 1 year, 7 months, she's 10 kgs. She's eating well, lose appetite. She doesn't eat as much without being sick. I don't know what to do. Usually, the rate of eating also changes as children grow older, so they may not eat as quickly or as much as they used to eat before because they can eat more at one sitting. So make sure your child is dewormed. Make sure you also sometimes it's also they are bored with the same thing. If you're giving them the same food all the time, make sure you try variety of food, introduce new things and all that. So I hope that's helpful, but you don't need to sweat it a lot. Your baby is not that bad. Your baby should weigh about 11 kilos, but it's weighing 10 kilos. It's not so bad, but you can just try new things, experiment with new things, and see how it works. 4 months old baby is choking, bring up breast milk through the nose. Yeah, that sounds like reflux. So if your 4 months old baby, when you're breastfeeding them, some babies you need to be, if they are rushing, sometimes you need to slow them down. You can take the breast out, let baby breathe in between. Okay, and then you can continue to breastfeed them. When you finish breastfeeding, try and rub the back and all that. So reflux is common in babies. Sometimes overfeeding, if they have taken too much, it can come back. Or sometimes you put the baby down immediately after feeding, then they can have the milk can go back. So it's a common thing in babies. So what you need to do is to make sure when you finish feeding the baby, don't put them flat. Keep the baby straight, rub their back, and that will be helpful. If it is so bad, some children have very bad reflux. You see a pediatrician, we can give something as well. We can give milk thickeners and all that, but most of them will do it will resolve. By the time they are on solids, then it's not something to worry about. Your baby is 20 days old, pass through that draw like mucus, oily in color, some particles and stool a lot. So it's on EBF. Well, I don't know. It depends on what you are eating yourself. Your baby is only on EBF, which means because I noticed that some Nigerian mothers say EBF, they just mean breastfeeding, whereas EBF means only breast milk, no water, no drugs, nothing else. So if you are giving anything else apart from breast milk, you need to stop all that. If you yourself
Mm,
as a mother, you are taking any medication,
mm,
watch them because it may affect your baby's stool as well, or even the food you eat. Some of this food that we eat that has some flavor or some supplements, it could affect baby's stool. So just pay attention to all that. But I'm not really worried about your baby. Babies pass stool a lot. Yes, they can pass up to 12 times a day. That's fine. That's normal. And it doesn't have to be, their stool is always semi-formed. It's not like complete solid or complete water, but it's in between, like egusi soup. We used to use that. But just make sure you're paying attention to what you eat yourself to make sure your baby is not uh it's not what you are eating is not what is affecting your baby. So oh my goodness, I think we've got it to 7. Yeah, we
that-
stop now.
yes.
Okay, so we've answered our question up to 7 p.m. So if your question is late, sorry, we have to close now.
Mm,
Please post your questions on our Facebook group and we will answer them. Please
mm,
don't ask questions anymore. And Messi is saying 10 months old who is no longer breastfeeding because of health issue has been poking, you mean poking, vomiting 3 to 4 times a day, or he usually pops before, unlike one, it's not watery. Okay, you see, okay, I think it's stolen you once a day, 3 to 4 times a day. Unlike before, it is not watery, it doesn't soak into the diaper. It started after he took antibiotics, yes. We usually take him for checkup every 3 months. Should I worry? No, you should not be worried. That's normal. So babies on antibiotics tend to pass they tend to have loose stools more frequently and all that. So once you're about this stuff, you should go back. But it's not even anything to worry about since the stools is not watery and all that. It's not having fever or sick. So why is it on antibiotics if it's not having fever or it's not sick? Please, how many times hourly should I feed him complementary feeding? This is no longer on breast milk, like I said. Okay, if your baby is no longer on breast milk, your baby should be on formula. So if your baby is not taking breast milk, you need to be giving age appropriate formula feeds as well. So your baby should still take how old is baby now? Is it 10 months or how old is baby? Yeah,
10
10 months.
months, 11 days.
So your baby should be taking at least 3 complementary feeds a day. and then you also need to give formula feeds. So like a 10-month old weighing about 9 kilos still need to take about maybe like 500 to 900 mils of milk in a day. So you still need to give milk. So but you have to give age appropriate formula milk. If you are not giving breast milk, you'll be still need milk. So you need to give milk, and then you need to give the complementary feeds as well. So it's really nice for you to do that. Okay, I think that is all that. Let me just finish
Thank
answering all
you.
these program people because they are really waiting for me. Okay, diarrhea and dysentery. Diarrhea usually is caused by infection. It could be bacteria, it could be viruses, it could be germs. Dysentery is usually bacteria. And the treatment for diarrhea, ORS, oral zinc. Dysentery, we need antibiotics. You need to see a doctor. Chanel say my 26-day people more than once in a day. And I was told it's not good for me to put more than once in a day. No, you are not. So what you are told is wrong. That is poor misinformation. Babies can pass through up to 8 to 12 times in a day. There's nothing absolutely wrong with that. So keep breastfeeding your baby, and there's nothing wrong with your baby. Please be careful where you get information. I do get a lot of information. They told me, they told you. Who is the who? If the person who is telling you that information is not a health professional, is not even just an health professional, it's not like a pediatrician or a website from a hospital or those kind of things, please don't take information from your neighbors or your fellow mothers as gospel truths. Most of them have ignorant, I mean, it's just wrong information. Like what this person just said now is pure misinformation. I mean, I've answered so many questions today already, so you know by now that babies can pass to up to 12 times a day, and that is perfectly normal. So that's not, and it doesn't mean babies, there's something wrong with the baby. Okay. Is it recommended to use baby cream on newborn baby? Why not? You can. Your baby needs to have skin moisturizer. You can use, but what we normally recommend, because some babies react to some cream because of all those chemicals, the perfumes inside them. Use natural product. You can use your olive oil. You can use your coconut oil. You can use your what's it called? You can use Vaseline, the blue one, the blue seal. You can use the normal ones, the other ones that they sell as well, as long as your baby is not allergic to them. If you use them, your baby reacts to them, stop. Use the one the baby will not react to. But some babies don't react to them, so it is fine for you to use them as well. Modupe Folari, my 7-month-old is losing weight from 8.3 to 8.25 since 7 months and now. Birth weight is 4.1. If a baby is losing weight, it's a red flag. A baby losing weight is a red flag. You may need to see a doctor. We want to know why. This weight loss is not really looking so significant to me. 8.3, 8.25. The first thing is to be sure that the scale itself is correct and it's the same scale and it's not an error of scale. But if it's like something significant now, we'll worry. But you before check first. So I would say recheck the weight in another maybe 1 week or 2 weeks. If it's going down, then you need to see a pediatrician. Meanwhile, make sure the baby is eating well, it's feeding well. Okay, final question on Instagram. Oh, no, not the final one. Somebody said, my son is 3 weeks old. He hiccups all the time. I don't know if you should worry. No, you don't need to be worried. Hiccups is common in newborn babies, and it's nothing to worry about. Just leave the baby alone. It will stop by itself. And yeah, if it's normal, God's new. After, I don't understand what you said, the last part of it, but hiccups is nothing to worry about. Just leave the baby alone to stop by itself. I guess that's okay. Blessing say, I'm a new mom. I took something that got me purging. I'd like to know if it will affect my baby because I'm exclusive breastfeeding. I want to know because you didn't tell me what you even took. So you will just have to wait and see whether it will affect your baby or not. I don't have that superpower to know. It depends on what you take. For example, if it's like a medication that can pass from you to your baby via breast milk, yes. If it is not medication, we won't know. So but just watch your baby, and if there's anything that you may need to see a doctor. Okay, somebody's saying my baby do choke on breast milk. I think I've answered that question on choking on breast milk, and I've told you what to do. So I believe you've got the answer perfectly perfect. Blessing, is there any kind of food or fruit we should avoid because of a new mom, not to affect the baby? No, there is none. So new moms, you don't need to avoid any particular food. Eat what you like, drink, take your fruits. avoid alcohol, basically, maybe alcohol. But otherwise, the normal food, the normal fruits, you can eat them. If you eat anything and your baby starts to react, stop it. So, but usually, whatever you eat that may affect you will likely affect your baby. So, whatever you are allergic to, then don't take. Otherwise, you don't need to take any particular food or anything. So I guess yes, okay, all the questions I've stopped. So thank you so much. Yeah, so yeah. Okay, so we've solved. Okay, yeah. Okay, Nick and Nobi, because of your question. Yeah, if the hernia is big and it's not going down, you need to let it be operated. There's no two way about it. Okay, I think these are all follow up questions. I believe we've answered all of them. Okay, good. I think we answered all the questions finally. All
Wow.
right. If you don't,
Wow.
if your question is not answered, don't worry. Just post it on the Facebook group. Or if you think we didn't answer it very well, maybe because we're rushing through, because I knew I rushed the last set of questions. Don't worry. Post it on our Facebook group and we will do justice to them. But I think at this point, oh, sorry, we've gone way.
Way
Oh,
beyond time.
thank you so much. Yeah.
Thank you, everyone, for joining us. I believe we learned a lot. And thank you, Dr. Gbemi. I observed you wanted to answer all the questions. Well done, ma. God bless you for
I
all you are doing.
try not to leave any question unanswered, but unfortunately, people don't post the question. Instagram people always
On,
do the last last man approach.
so
But at least
mothers,
I can
fathers
answer.
should also endeavor to send in questions on time so that we can answer all the questions on time also. Thank you very much, ma. Thank you, Nigerian mothers and fathers, mother-tricians, father-tricians. We love you. Thank you. Well done.
Thank you so much. Just to let you know that this program is brought to you by Atplivemonday Foundation. We are committed to the health, the well-being of Nigerian children, not Nigerian children, children globally. Okay. So if you have
Yes.
any questions, don't worry. We have 3 Facebook groups. Ask the Pediatrician Facebook group. You can post your children health questions there Mondays to Saturdays, 24 hours daily. Ask the ATP, ask the physicians, I mean, ATP family. We can post your own health questions there. And if you have lost a child or pregnancy and you need support, we have what we call ATP Still a Mom Facebook group. You can join us. We will be there to give you some emotional, psychological support by trained professionals. So thank you so much for joining me today. I'll see you guys same time next
Bye.
week. Bye, everyone.
Bye-bye.
You enjoyed
Bye.
this today. All right. Take care. Bye,
Bye.
everybody. Oh, somebody's on
Bye.
YouTube. Okay, Damilola. Thank you. I always like it when I see somebody from YouTube. Good. Thank you for joining us. All right. Take care now. Bye.
Bye.
Bye. Oh, have I ended it? Oh, no.